previous video, I have already spoken about the natural causes of developing diabetes which you cannot prevent at all, and few other causes of developing gestational diabetes during your pregnancy time. If you have not watched that video, I would request you to watch it because you will get a lot of knowledge about it. In this video, I am going to talk about how you can prevent gestational diabetes before you just get pregnant. So let's talk about it. There could be two scenarios to lower the risk of getting diabetes during your pregnancy time. If you had gestational diabetes during your previous pregnancy and if you are planning to become pregnant again, then first of all you need to talk to your healthcare provider. So your gynec will perform early screening to check the risk factor of developing diabetes and ensure you have a healthy pregnancy. In this case, your healthcare provider will run some tests in the first trimester only, so he or she can identify the risk factors, and if that situation is going to occur in the second trimester, they will take extra precautions and measurements to prevent you from gestational diabetes. In other scenario, if it is your first pregnancy, then first of all you need to prepare your body for pregnancy, and after that you can make plan to become pregnant. For that, you can also talk to your healthcare provider who can decide the best diet plan and regular activity for you. And if you have any condition which can lead you to become diabetic during pregnancy time, you have to treat and control it before becoming pregnant. Like if you have thyroid problem or if you are already overweight, you have to control it. Now what you can do, if you are already overweight, then before becoming pregnant, I would suggest you to lose weight, and for that you can also take the help of dietitian who can recommend the best diet plan for you, in which you can also get the maximum amount of nutrition and you can also lose some pounds. Once you become pregnant, you are not supposed to lose weight at that time until your doctor suggests. Most people receive gestational diabetes test in the second trimester only, and here you need to understand that you cannot reverse this situation if you have gestational diabetes. You have to take step before getting pregnant only, or you can reduce the chances of getting diabetic during your pregnancy time. How it affects your baby? This could be serious condition. If you have gestational diabetes, you have higher chances of getting C-section. Because of diabetes, your baby can grow too large, and your baby can also have chances of developing diabetes in future. Your baby can have breathing problem or jaundice or lower level of blood glucose at the birth time. So it is really essential for you to control your glucose level even before getting pregnant. This kind of diabetes usually goes away after your delivery, and your doctor will run some blood tests after your delivery. But again, you can have chances of developing diabetes in the future, so you have to take care a lot. There is a good news that most of the pregnant people control gestational diabetes just by changing in food and lifestyle. So you can also do that. You need to follow few things, like you need to avoid junk food and processed food and sugary drinks. You can eat smaller meals that can really help you to digest your food easily, and you can also schedule the meal at the same time. Choose a healthy balance of proteins, carbohydrates and fiber in your diet so you can prevent gestational diabetes. Eating balanced diet and exercise during your pregnancy time would be the best way to prevent gestational diabetes. I hope you have liked this information. If you think this is useful content for you, then please click on subscribe button. I will see you in my next video. Stay tuned.